to your English news broadcast live on ERi-TV. It's exactly 10:30 p.m. on Eritrea's local time from our headquarters at Asmara with your domestic and international news in brief. I'm Zahra Badouri, but first we'll begin with your major headlines for this hour. An announcement from the Ministry of Health. New health station and kindergarten in Qartzat. And on your international global COVID-19 cases, vaccination coverage according to yesterday's report. Smoke in Romania's Petromedian refinery following blasts. Welcome to your domestic in brief. 14 patients have been diagnosed positive for COVID-19 in tests carried out today at quarantine centers in Asmara Central Region, as your health report. On the other hand, 42 patients who have been receiving medical treatment in hospitals in the Central Region have recovered fully and have been discharged from these facilities. The total number of recovered patients have accordingly risen to 5,718, while the number of deaths still stands at 25. The total number of confirmed cases in the country to date has risen to 6,088. Ministry of Health, Asmara, 4th July 2021. New health station and kindergarten has been constructed in Qartzat administrative area, Halhal subzone, at a cost of 8 million nakfa, indicating that the health station that was constructed at a cost of 7.4 million nakfa is expected to provide health services to residents of 7 villages in Halhal subzone and nearby villages of the subzone of Asmat and Habaro. Ambassador Abdullah Musa, governor of the Ansaba region, called for reinforced regrouping of villages so the residents became beneficiaries of social services provision institutions. Nurse Saleh Abu Bakr, head of the health station, said that the health station that is equipped with sufficient facility has already started providing prenatal treatment and delivery as well as vaccination programs. Nurse Saleh went on to say that the health station has OPD rooms, first aid center, maternity bedrooms, pharmacy, among others. The residents on their part indicating that before the construction of the health station, they were compelled to travel 18 kilometers to Malabso to get medical treatment, and to date, they are able to get medical service in their backyard. Similarly, the kindergarten that was constructed at a cost of 700,000 nakfa has 2 classrooms and 1 office. Proceeding with your domestic news, owing to the sustainable awareness rising activity, the residents of Natfa subzone are conducting commendable environmental sanitation activities, indicating that the Ministry of Health branch in the subzone is conducting sustainable awareness rising programs with a view to control the prevalence of communicable diseases. The residents expressed conviction to reinforce participation for the realization of the program, pointing out that as a result of the village regrouping, the residents have become beneficiaries of various social services provision. Mr. Tasfai Eyob, head of the social services in the subzone, called on the residents to make judicious use of the social service provision institutions for their sustainability. And on your final domestic, at an activity assessment meeting conducted on 1st July in Barantu, calls were made for reinforced participation of the residents with a view to develop the teaching and learning process. The meeting was attended by school directors, representatives of various administrations, as well as stakeholders. At the meeting, reports was presented on the achievements registered and challenges encountered, and the participants conducted extensive discussion on the reports presented. According to reports presented by Mr. Dawit Kalala, head of the Ministry of Education branch in the subzone, in Barantu subzone there are 38 schools ranging from from preschool to high school and 11 adult education centers. Mr. Muhammad Ali Ibrahim, head of the Ministry of Educational branch in the Gashbark region, on his part called for reinforced participation of the public in the effort being conducted to expand educational opportunities to all and teachers to realize the quality of education. Up next with your global news, do stay tuned for more. And on your international report, the total of global COVID-19 cases surpassed 183.8 million, with the death toll exceeding 3.9 million as of yesterday. This is according to the World Health Organization. The total number of confirmed cases for COVID-19 in the United States reached more than 34.5 million, with the national death toll reaching more than 621,000 yesterday. This is according to Johns Hopkins University. India's death toll from COVID-19 surpassed 400,000 yesterday. This is according to the country's health ministry. As many as 853 people died in the past 48 hours, taking the country's death toll to more than 400,000. India has recorded 30.45 million cases since the outbreak of the pandemic last year, and is the second most affected country behind the United States, and which has 33 million cases. Brazil registered 2,029 more deaths from COVID-19 in the past 48 hours, bringing the national death toll to 520,095. This is according to the health ministry. More than 99.8 million cases of COVID-19 vaccines have been administered nationwide in Brazil, and over 26.1 million people have received two jabs. Dear viewers, that is all for now with your domestic and international news in brief. But before we end our broadcast, these were your major headlines for this broadcast. On your domestic, an announcement from the Ministry of Health. New health station and kindergarten in Kartsat, and commendable environmental sanitation activity, as well as calls for reinforced participation to develop teaching process. And on your international, according to yesterday's report on COVID-19 cases and vaccination coverage. And finally, smoke in Romania's Petromedia refinery following blasts. That is all for now. Have a nice one.